Welcome back to the program, everyone. My name is Dr. Dan, and I'm a pharmacist turned weight management specialist. Today, we're going to dive a little bit deeper into these obesity medications and some of the potential downsides. My last video, we talked about some of the common side effects that can be associated with the GLP-1 receptor agonists. So that's like Saxenda, Ozempic, Wegovy, and that sort of thing. And today, we're going to dive into this black box warning about thyroid cancer when it comes to the GLP-1 receptor agonists. What does that even mean? Do we actually need to be worried about it? And heck, what is a black box warning to begin with? And I'm going to tell you all of that and more. Now, it's pretty common that when we throw around which is black box and cancer, our ears tend to perk up and we start paying a little bit closer attention, which is absolutely fantastic. By no means should we take these words or these things lightly. They're in place and part of the system of checks and balances in order to protect patients and to protect people. However, as with anything, we need to look at the picture in its entirety. So we need to look at all the different pieces and stuff that goes into it to determine if the evidence is warranted and if it applies to you in your given situation. So first things first, what is a black box warning? So a black box warning is the most stringent warning that the FDA and other health agencies across the globe can put in place on top of medications and medical devices. Its purpose is to serve as a reminder and a red flag for clinicians who might be prescribing or using these medications with their patients and the patients themselves. It tells us about a potential serious side effect, potential injuries, or even death that might occur with these medical devices or medications. It's a pretty big deal. It kind of reminds me of the look that my mother was able to give my brother and I as we were growing up, especially when we were being little shit disturbers in public. We knew that if we didn't smarten up, that look could result in side effects, injuries, or death as well. Yeah. And clearly I made the smart choice a majority of the time as I am here before you to actually create this video. Okay, so what does the black box warning, risk of thyroid C-cell tumors, actually mean? So this is the black box warning that is in place for the GLP-1 receptor agonists such as Ozempic, Saxenda, Wegovy, and that sort of thing. Now, this warning is in place for a very specific type of thyroid cancer called medullary thyroid carcinoma, or MTC, which originates from the C cells within our thyroid. And even within the thyroid cancers themselves, this is a very rare type of thyroid cancer and accounts for only about 3% of the thyroid cancer cases. Now, another condition that we're worried about is what's called multiple endocrine neoplasia 2, or MEN2. And this condition is an endocrine condition that has been associated with the development of MTC. So, if you are sitting there, kind of like I was, and wondering, hey, I wonder if I've ever had any of these conditions before, no one's ever told me about it, you can be pretty assured that at some point in time, if you actually did have these conditions, a specialist of some kind would have told you so, and you likely would remember it. Again, they're quite rare and very specific. And this black box warning is in place for individuals that either have a personal or a family history of MTC or MEN2. In which case, the GLP-1 receptor agonist medications would be contraindicated, or in English, they essentially can't take these medications due to the risk being too high of them developing this medullary thyroid carcinoma. All right, cool. That excludes that group of people. Well, what about everybody else? So this is where things get really interesting with MTC and this black box warning. And big in part, it's because we just have a lot of unknowns and there's a lot of question marks around the data and as to what exactly is going on with regards to MTC, MEN2, thyroid carcinoma, and that sort of thing. You see, the black box warning was originally put in place based on animal studies. And what the researchers had found is that when rodents were exposed to GLP-1 receptor agonists, such as Ozempic, Victoza, Saxenda, that sort of thing, these rodents, or at least a small portion of them, actually developed MTC. Now, these results have yet to actually be replicated in humans at this point in time. Now, looking at the data from some of the big landmark trials with some of these GLP-1 receptor agonists, such as Victoza and Ozempic, what was found is that there was some cases of MTC that occurred. However, the cases were very, very rare, and the cases actually seem to be happening at a similar rate in the drug group, so the groups that were getting the Victoza, Saxenda, Ozempic, and that sort of thing, and the placebo group, so the group that wasn't getting the actual medication. So they were happening at a similar rate. So it kind of shows us that Well, maybe the drug isn't actually having an effect. Just MTC does happen spontaneously within the general population, and so it seems to be equal between the drug and the placebo. And furthermore, when we kind of took all of these landmark trials and combined them all together in what's called a meta-analysis, or the highest level that we can have in terms of clinical research, what essentially was seen was a similar result, was that the rates of MTC development were happening at the same rate in the drug group as in the placebo group. Okay, cool. So I know I'm really providing you some groundbreaking information. It seems pretty obvious that, well, MTC happening in rodents, okay, that's rodents. Rodents are clearly different than humans, and you're saying that it's happening at the same rate just spontaneously in humans as compared to the drug group. So do we actually have to be worried about MTC? Why do we have this black box warning in the first place? Now, just stay with me here, and I will show you the way. You see, one of the big issues here is that we don't entirely know the full mechanism as to how the GLP-1 receptor agonists actually cause MTC within rodents. You see, we know that rodent thyroid cells have a receptor that these GLP-1 RAs, or receptor agonists, can actually bind to and exert an effect and seem to proliferate and lead to MTC. On the flip side, human thyroid cells also seem to have this receptor that the GLP-1 receptor agonist medications can also bind to. So does that mean that the GLP-1 receptor agonist medications could also lead to the development of MTC in a similar fashion, such as that is found in rodents? Maybe, possibly, we actually have no idea, and the data doesn't seem to support it right now. You see, the reason for the big question mark is that while human thyroid cells do have this receptors that the GLP-1 receptor agonist medications can bind to, these receptors are actually at a much lower concentration in the human thyroid cells compared to the animal thyroid cells. Furthermore, when we look at cell studies or petri dish studies, basically we have a blob of cells within a little dish on top of a laboratory desk or whatever like that, and we add some of this GLP-1 receptor medication to cells, we see that the medication binds to the receptor. However, it doesn't exert the same effect that we see that occurs when we do that same study with rodent thyroid cells. So it's a bit of a confusing cluster F, if you will. And if you aren't confused by that, because I certainly am just trying to explain it, I'm going to show you a little diagram that's hopefully going to help kind of clear things up a bit here for you, okay? So looking at this little picture right here, this is a much, much better depiction than my wonderful description, but it really shows here that when the GLP-1 receptor agonist medication binds to the thyroid cells within rodents and within humans, the different actions that seem to take place. And diagram A is what's happening in the rodent cells, and diagram B is what's happening in the human cells. So the million-dollar question, do we actually need to be worried about this black box warning and this risk of thyroid cancer or not? So for now, we should continue to follow the black box warning. So those individuals that either have a personal or family history of MTC, so the medullary thyroid carcinoma, or the MEN2 condition, the multiple endocrine neoplasia type 2 condition, they should avoid the GLP-1 receptor agonist medications altogether, at least until we have a greater understanding of what exactly is happening within the human thyroid C cells. Black box warnings definitely get revised and taken away as more evidence is presented, so stay tuned. For everyone else though, the GLP-1 receptor agonist medications appear to be safe, and likely the risk of MTC for the regular Joe Blow is near nil or zero. As for the other types of thyroid cancers, tumors, and issues and stuff like that, based on the literature, there should be no issues using the GLP-1 receptor agonist medications. And I want to answer this one specifically because I know it'll come up. If you have a history of hypothyroidism or a condition called Hashimoto's disease, where your body is attacking your own thyroid, you can still use the GLP-1 receptor agonists as well. However, as with anything, please follow up with your personal care team to ensure that these medications would actually be safe and appropriate for your specific circumstances, and only you and your care team are going to be able to decide that. So that's all for today, my friends, on the thyroid cancer black box warning that comes with the medications, the GLP-1 receptor agonists. Stay tuned for my next episode where I talk about pancreatitis and pancreatic cancer that is associated with the GLP-1 receptor agonists, such as Ozempic. That's another big controversial topic there, and I'm going to dive into the evidence and give you guys all the details that you need to know. As always, though, don't forget to hit the subscribe button down below so that you don't miss another episode. As well, check me out on my other channels. We're on all the social media channels, including Instagram, TikTok, you name it. I put a ton of content out there as well, and that is my handle, the official Dr. Dan. And until next time, my friends, always remember that small tweaks lead to massive peaks.